Hi, it's Dr. Denny over at For Positive Fulshire Veterinary Clinic, and we're going to be talking about what the prognosis might be if your cat has cancer. So, Maddie's going to get us started with some questions.
Dr. Denny, can my cat's cancer be cured?
Some of them, yeah, of course, some of them can. Especially if it's an actual growth that we can just remove. So my cat had to have a growth removed off his face. That was curative. Like it's gone. Cut it out, gone. Other types of cancer, not so much. Like gastrointestinal lymphoma, it's very common in cats. They can go on oral medication to keep it in remission, and it'll work for a really long time, but it's not going to work forever. So it's going to be really dependent on what specific type of cancer your cat has, what stage, has it spread, etc.
How long can my cat live with cancer after treatment?
So it depends again on what kind of cancer your cat has. If it's GI lymphoma, we can live for a really long time. I would say that it's not like you take a medication and it's one and done. A lot of these meds are chronic, especially when we have an organ like the gastrointestinal system that's affected, because it's not just one area, usually it's the whole thing. If this is like a cancer of the mouth, depending on if we're catching it early or not, sometimes radiation and chemo can shrink it down, but you're still looking at maybe months to years. Every cat's going to be a little bit different. Certainly, the statistics that we can talk more about, if we have a diagnosis and go based off what specific type of cancer your cat has.
How long can my cat live with cancer without treatment?
So, if it's a rapidly growing type of cancer, we may only have weeks to days. It's going to be very variable. And you're going to know if your cat is just going downhill, you're going to know that things are not, good in kitty cat land. If your cat's not feeling well, they're hiding, they're lethargic, they're not wanting to eat. Like maybe they cuddle with you on the couch and they're not doing that anymore. Maybe you're not allowed to go to the bathroom by yourself and your cat's always with you, like mine. And then all of a sudden they stop doing those behaviors that like honor the human animal bond. And when that bond starts to fracture, you know that they're not feeling well.
How can I prevent cancer from occurring in my cat?
So there's no preventative medicine. I think like if you could develop that, you would be a gajillionaire, right? I know that's not a word, but you would be a very wealthy human because we don't even have that in humans, right? We have early detection. There's some genetic screening that in humans is being utilized, but we don't have that necessarily in veterinary medicine just yet. So unfortunately, I don't really have an answer for you there.
How do I know if my cat is suffering from cancer treatment?
So if your cat is not eating, if they're lethargic or if they don't feel well, and when maybe we're experiencing some side effects like sedation or decreased appetite, these are things that you need to let us know if they're not doing well so we can make adjustments.
How do I know if my cat is nearing the end of their life due to cancer?
So we're really going to be looking at what their quality of life is like. You pause it. So when we're talking about quality of life, and you're really wondering if it's your cat's time to be let go or like give them their angel wings, we're really going to be looking at what's 5 things that make your cat who they are. You're going to know these things. I won't. I generally. Eating and drinking is important, but we also want them to be enjoying their lives. Like eating and drinking is instinctual. We need to eat and drink to survive. But we also have to pay attention to like the simple pleasures in life. Getting petted, sleeping with you on the couch while you're watching TV, talking to you in the morning while you're getting ready. My cat is up on the counter chattering away at me about whatever he's talking to me about in his kitty cat language on how his night went. That's one of my cat's things. Your cat's gonna have those things. And if we're not seeing those behaviors, if all they're doing is sleeping or hiding, then that's not a good quality of life. And we need to consider if it's time.
What should I know about end of life care?
So I believe in palliative care for sure. I think controlling pain, nausea, any side effects from the cancer, is something that we need to look into. And we also need to be cognizant of, okay, well, what happens when we're on our entire lives and the cat's life is being just medicated. And then our cat starts to hate us because we're having to medicate them. We don't want that. So I think it's a delicate balance between making sure we're giving meds to keep them comfortable and also not impacting the human animal bond. So if you're noticing that, hey, my cat has cancer, I'm doing 5 different medications a day, and now my cat is running from me. And everything that made that your cat special and you guys have that special bond, if that bond is gone, we need to start talking about, okay, is this fair to your cat to continue, because you're making their lives miserable. So I hope this helped you kind of figure out where you're at in things. If you do have questions about end of life care, please give us a call and we can talk more about it. Thank you.